We did a lot with a little. The players in the organization were new to the magnet journey and the requirements to showcase nursing excellence. So I spent a lot of time working with a team to say, identify your empirical outcome that you're trying to impact. And as you're doing improvement work, watch your data. We're not going to back into any of these examples, right? We want to be deliberate and in their practice and in their work and clearly identify what are the pre-data, what are the interventions that you can use based on evidence to potentially impact the outcome. And then now let's look at your post data once you put those things into place. And they became really great students, if you will, to that quality improvement work. They had a lot of high threats that they had to resolve. I mean, patient satisfaction was a significant threat for them. They had a lot of reasons why they weren't outperforming patient satisfaction, not the least of which was they just said overall the community. There was a gap in communication styles between their patients and the nursing team, even though their nursing team is fairly diverse, but they had a lot of reasons why. And we kept saying, well, but you need to look at the questions that are being asked. And regardless of what your clientele is, the nurses need to be working with those patients and address what those concerns are. That was the biggest message we kept delivering. And the really cool thing about this client is they listen to us. So if Stephanie or Jason had recommendations on what it is that they could do to improve their patient experience scores, they listened and they did that work. And we saw noticeable changes in their data quarter to quarter. I mean, Stephanie, what do you?
I would agree. That was one component of it for sure. And like I've said before, is the second component was that their particular vendor that they utilized was not a vendor that has a lot of peer groups or benchmarking capability. So the CI team did get on call with them directly, and they were able to assist and pull out, a couple more different ways to look at their data and benchmarking, which was helpful to some extent. So between work that they did, and they were listening to us about the questions, and joining teams with their vendor, which were very engaged and wanted to help, we were able to pull it together and get them to that outperformance.
Look at when they first started with us. They were not looking at ambulatory indicators at all. The good news is once they figured that out, they found that they were outperforming. And so it was a nice thing that they were able to celebrate with their teams and say, hey, compared to the benchmarks, we're far exceeding these benchmarks from a nursing sensitive indicator perspective. I mean, the MPD she was amazing. You would tell her, this is your gap, and then she would work with the teams. And they did some really neat things. Certainly, their nursing team is very competitive with one another. And so she did a lot of activities that put teams against one another to see who could do better. And what that meant is they're doing these competitions, but who's the winner? Really, the winners are the patient. I was a huge proponent of that as somebody who's very competitive and likes to win. I kept thinking in the back of my head, yeah, well, this particular unit might have won that competition, but again, who the real winners were the patients. And so it was just a strategy that the MPD used very successfully throughout their journey.
Yeah, I agree. And I think when you mentioned a little bit earlier, when Jason would deliver, they would lean in and they would listen and they would look at that data and analyze it and go, oh, so that's the connection between these. Oh, if I do this, then the outcome could impact this as well. So they really took all of that information in and really utilized it to make improvements.